official video number 1 after the trailer. Okay guys, I am super excited about this video because I'm gonna be answering your questions on Instagram. So if you haven't followed me, follow me on Dr. Sheila Derm, and I am super active on there pretty much all day. I'm always doing stories. All right, so let's get right into it. By the way, I'm Dr. Sheila Derm. I am a board certified dermatologist, just started this channel, so definitely comment below if you guys have any questions. That I will be doing tons and tons of Q&As. They're really quick, like spitfire, and if you want me to touch on anything a little longer, like a dedicated whole video to it, definitely let me know. And while you're at it, click that subscribe button and click that notification bell. All right, let's get into it. Question number 1 is, should I include a toner in my skincare routine? All right, toners, in my opinion, and this has changed over the last maybe 10 years of skincare, toners were always like included. You saw them in the Proactive little pack, but actually, most of the toners have been alcohol-based, which is super stripping of the natural oils that we have on our skin. It disrupts the pH of our skin. And so nowadays, toners are coming out that are alcohol-based, which are better. But toners, they're basically an astringent used after your cleanser to take off that excess oil, dirt, makeup, what have you. But they, like I said, they can be really stripping, especially when you use a cotton pad and really rub. The only times I do recommend toners for my patients, or what I say on like my channel or magazine articles, is if you have super oily skin, especially that T-zone area, in the summer, and if you live somewhere that is very humid. So in those cases, you can kind of dab, get a little bit of that oil away. But instead of toners, I have actually been recommending micellar water. So micellar water have little oil particles in them, and the oil is a surfactant. It's called little micelles, and they actually attract dirt and oil. So it does do the same thing, but in a very like softer way. It doesn't disrupt the pH of the skin. In fact, it rebalances it, and it also is not over stripping. It does remove some of the oil, and it does help the oil production. And what I really love about micellar water is makeup removing. So you really kind of need an oil-based water or product or serum to remove that mascara, that eye makeup. And so my sister is actually an optometrist. So she deals with eyes, eyelash extension, people coming in for like infections on that. And she really likes micellar water for the eyes as well. So it's double approved. All right, let's get into the next one. When should I start Botox? All right. So Botox is a brand name. The medical name or scientific name is Botulinum toxin A. Okay, so there's a lot of different brands. Botox is just one that is the most popular. It was the one that was first approved for cosmetic purposes. And there's Xeomin, Dysport, Jeuveau. There's another new one coming out in the Revance family that actually lasts a little longer. So for the sake of just ease, I'm just going to call it Botox as well. I also provide that in my office, as well as the other types. So basically, the mechanism of action of botulinum toxin is that it relaxes the muscle. So the muscles aren't firing as strong as they did before injecting it, okay? It doesn't do anything regarding volume. Fillers are a completely different story that I can get into in a different video, like a compare and contrast. Toxins can be used, and I know it says toxins, but the byproduct of the neuromodulator, Botulinum toxin A, is from Clostridium botulinum, and so that's where the name came in. And so it's not really a toxin per se. You're not going to die from little injections on the muscle. However, this is also a medical approach to it. So people who need it for spasms or other medical causes may get way more doses, like in the hundreds. For Botox, for cosmetic, like around the face, like pretty much 50 is the highest I'll go. For baby Botox, I'll go in like the 20s, and I can kind of talk about that as well. But anyway, it's not a toxin, it's not gonna kill you. Is it natural? I mean, what is natural? It's like such a difficult thing to say. However, will it help with your anti-aging? For sure. So by decreasing the muscle activity, it decreases the tension, okay? So usually you do it here, 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 and I do it other places, like I do it in this area for facial slimming, I do it around the lip for a lip flip, and I also do it on the columella for a little nose lifting, because if you are kind of knocking down or softening up the mechanism of the muscle activity in one area, the opposing muscles are actually going to overcompensate, and that's why I love Botox for lifting. As you can see, my eyebrows are lifted, maybe a little too lifted, because I have to go back and retouch it, because I usually do it and then have people come back 2 weeks and retouch it, because that is when it actually is at its full potential of kicking in a way. It starts kicking in like a few days in, and then you see like the full effect in 2 weeks, and it lasts about 3 to 4 months, depending on how fast you metabolize it. So in your 20s to 30s, I like this for prejuvenation. People really like it in this area, especially if they make like a really strong like frowning face, this thinking face. By doing this, you're preventing the wrinkles from kind of being etched in later, like your late 30s, 40s, 50s. And I'm talking low baby doses, so in the 20s, okay? I always say like do your units about how old you are, and usually you shouldn't be doing it under the age of 20. I started doing it in my mid to late 20s, and I think that's not a bad place to do it. But I think most patients that are coming in are in their 30s, so that's a good time to start thinking about it. And you can really talk to your provider and be like, do I need this? I've had people come in their 20s, and I'm like, girlfriend, you do not need Botox, because she doesn't need it, you know? But if I do it, I will, you know, if they want facial slimming, or if they want like lip filler, but they're not a really good candidate for lip filler, or they're just smiling and then their upper lip completely disappears, put a little couple units of Botox in there and it'll boop, flip it out. So Botox lifts, if done the right way. Some not very good injectors overdo it, so this is all basically paralyzed, and then you drop. Your eyebrows drop, you can't make any facial expressions. You do not want to go to that type of injector, okay? You want to go to someone who really knows their stuff and who will do less units and knows where to actually inject. So it softens the strong kind of muscles in that area. It can lift. It can actually soften those, by softening those muscles, it softens a lot of those little fine lines as well. So that's why it's good around the crow's feet, okay? And also what it does is it prevents. So if you're not making those faces, if your muscle is relaxed in that area, then it's preventing those lines from coming in the future. So those are the reasons why I use them. Again, if you're on a really good skincare regimen and you're using sunscreen, that is way more important than making sure that you're on the Botox like boat, okay? But definitely if you're thinking about it, late 20s, 30s, very little bit amount, but you can get away with a really, really good skincare routine as well. But if you want it for a little bit of eyebrow lifting, or, you know, like around your eyes, if you feel like you have more wrinkles than your girlfriend or whatever, come in for a consult and we can talk to you about it. So I would say 30s, even though I did it a little earlier. Hopefully that helped. Let me know again, comment below if you guys want me to do a video on like Botox versus filler, because there's a lot of confusion, especially on YouTube, about what these are. These are completely different things. And I think I went into a lot of good detail. I could just shorten a lot of these answers and just do like maybe 5, 6 questions, but you guys let me know. I have a huge list here, and again, don't forget to follow me on Instagram, where I will ask a lot of these like ask me anythings on my stories, where you guys can kind of ask. It's a little bit more interactive over there, but I will try to, of course, look at all the comments below and answer them, and then use them for my future videos. So thank you so much for tuning in, and I will see you in the next video.